saw you. Are you currently wearing glasses or contacts? Okay. And have you been sick in the last couple of weeks? Okay. And are you having any specific problems today? Okay. Any nausea, vomiting, dizziness, vertigo? Okay. So nothing to be concerned about. You just want to make sure that everything is up to date in the system and that you're still healthy, correct? Perfect. I'm going to put my gloves on and we'll get started. Okay, so the first thing I'm going to do is I just want to check your facial muscle movements. So I'm going to have you smile. Okay. Frown. Okay. And puff out your cheeks. And don't let me close them. Perfect. Raise your eyebrows. Okay. Look to your left. Look back at me. Okay, now look to your right. Look back at me. Perfect. Can you move your chin forward? Okay, move it back. Can you shrug your shoulders? Okay, shrug them again, but don't let me push them down, okay? Perfect. Now, what I want to do first is I want to update your measurements. Is that okay? So I have my little measuring tool here, and I want to just measure your face. So just relax for me and just enjoy this. And I'm just going to write that down. Okay. And I'm going to measure from the forehead to the chin. Good. 2.4. And I'm going to measure your chin to your nose. Perfect. 1, 2. And from your eyebrow to your eyebrow. Perfect. 3, 2, 5. Alright. Let's move on now to a quick nose swab, okay? Is that alright? It's just for our records. So I'm just going to swab the left nostril here, okay? So just going to go. Perfect. And we're going to go in the right nostril. Perfect. We'll go and have this tested. It should be about 5 minutes, and we should know if you are sick at all, but I don't think that you are. Next thing I'm going to do is just have a look at your tonsils. Have you been experiencing? The next thing I'm going to do is just take a look at your tonsils. Have you been experiencing any throat pain? Okay. I just want to make sure that there's no swollen tonsils. So if you could just open your mouth for me. I'm just going to take a look at that. Okay, your tonsils are just a little bit red, but no worries. It is allergy season again, so I do not think I need to be worried, especially if they don't hurt you. Okay, so now we're going to move on to testing your oxygen levels. Okay, and I just need you to put your finger in here. Okay, so just, and I'm gonna let you have that. And I'm gonna check your temperature. So I'm just gonna go. Perfect. Temperature is normal and oxygen is normal as well. Great. Okay, so now that we know that your oxygen levels are perfectly fine, I do want to just grab a piece of your hair as part of our DNA package that we keep in the hospital here. So I'm just going to actually look for a sample of hair. Alright, we've got that sample here. And we're just going to keep that in our fingers I'm holding up? Good. 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 Let's do the same thing on the other side. Good. 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 Awesome. And so now I want to just take a look into your eyes. I want to take a look up at your optic nerve and your eyelashes just to make sure that everything is still healthy. Is that okay? Perfect. So I'm going to come up pretty close to your face. I would like for you to just relax and look at my nose, okay? Perfect. So I'm just going to take a quick look into the optic nerve. Looks good. I'm not seeing anything that looks of concern. I'm seeing normal veins and normal eyelash distribution. Good. And I'm going to have you just look over there, and I'm going to look into your right eye. So I'm just going to take a look. Okay, so the optic nerve is intact. There's normal eyelash distribution, and it looks like the optic nerve looks absolutely just perfect. The veins are looking good. Nothing to be worried about. Great. Sorry about the light there. Hopefully it wasn't too much for you. If you need to blink a few times, that's okay. Now what I'm going to have you do is we are going to do a few light tests. So I want you to tell me where do you see the light right now? Okay, I want you to point at the light. Good. Can you point at the light again? Perfect. And again. And just point at the light one more time. And again. And just follow the light. Okay, follow the light again. And again. Good. So now I want you to just ignore the light. Okay, ignore the light. How many fingers am I holding up? Good. Continue to ignore the light. How many fingers am I holding up? Good. Okay. Good job. You're doing great, by the way. What we're going to do now is check your sense of color. Can you see color? Okay. So I've got a Okay, so I have you just close your eyes. Okay. Is this sharp or dull? Good. And this? Good. And this? And this? You're doing amazing, by the way. You got them all right. Now I have a test, okay? This is what's gonna tell me if you can feel above the eyes. And so I'm just gonna scrape your eyebrow a little bit. Did you feel that? Good. And did you feel that? Perfect. That sounds great. Okay, now I have another test. And this is going to be a little bit on the sharp side, but I promise I will not hurt you. So I want you to tell me if you can feel this or this. Okay, let's go ahead and do that. Was that sharp or dull? Okay. Good. And this. Good. And this. Awesome. Good job. Okay. Now, I'm going to do a acupressure test on your face. This is also a pokey device, but it will not hurt. And so I want you to just tell me where I am pressing on your face. And again, with your eyes closed. Okay. Where am I pressing? Good. 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 Awesome job. Okay. Now, I do have this reflex hammer, and I do want to just check your reflexes. So I'm going to check your reflexes in your arm. So can you hold out your arm for me? Okay. Good. And your other arm. Can you hold out your other arm? Good. And your knees. Okay. So I'm just going to palpate your knees. Good. Awesome. All right. Now we're going to move to your nose, your sense of smell. Have you been having any smell issues lately? Okay. I'm going to check for a deviated septum before we check your sense of smell. Is that okay? All right. So let's check your nose. I'm gonna have you look up just a little bit. Okay. Perfect. I'm just going to take a look into your nose. Okay, no deviated septum. Perfect. I'm going to look into your other nostril. Just going to check. There's nothing wrong. It looks good. Okay. So, no deviated septum. You can put your head down. Everything looks good. So I want to test your sense of smell. And I have a few different scents here in my spray bottles. So I'm just going to spray on here, and I will have you smell. Alright, so. And what did that smell like? Good. That's exactly right. Let's check this. This is more of a, it's a very citrusy smell. Yes, lemon. Okay, one last one. And what did that smell like to you? Right, chocolate. Good job. And I forgot to actually palpate your nose. And so I want you to tell me, does it hurt if I palpate your nose at all? No. Good. So nothing's wrong with your nose, no pain. Let's move on now to your hearing. So what I want to do first actually is I want to whisper some things into your ear. And I want you to repeat them back to me. Okay? You're amazing. Good. Coconut, coconut. Good. Watermelon, watermelon, watermelon. Good. ASMR. but that is totally normal, okay? You don't need to worry. If you do, however, feel any pain in your ears, then you might want to go get your ears flushed out, okay? Sounds good. I do have a tuning fork here, and I do want you to tell me, okay, which sound is going to be louder. So you're going to hear a sound here and here. So I'm going to go 1, 2. I want you to tell me which one's louder, okay? Okay, which one was louder? The second one? Good, okay. Let's do that on the other side. The second one. Good, okay. Now, close your eyes. We're gonna do that again. Okay. Now tell me which one's louder, number 1 or number 2. Okay. Number 1 should have been louder. Okay, let's do the other side. Number 1 should have been louder there as well. Good. Alright, sounds good. So you really have no problems with your ears either, but I will do one more test. I'm going to close this ear. I want you to tell me when you can't hear this sound anymore. This is what it's going to sound like. Okay? Good. Good. Awesome. Your ears are perfect, just like your eyesight. So now I do want to take another look into your mouth. I just want to make sure that there's nothing in your mouth that, is of concern. Okay? So I'm going to take a look into your mouth and just double check everything. And we're gonna then, after that, we're gonna do a sense of taste. Yes? Okay. Could you open your mouth? Perfect. Just open. Okay, so I do see that there's 1, 2, 3, 4, 5, 6, 7, 8. Okay, I see lots of teeth. Let me look at your tongue. Nothing to be worried about with your tongue. Have you had any troubles tasting things? Okay, well, let's do the first test, okay? Okay, can you stick out your tongue? Good. Okay, what does that taste like? That's right. Let's do this one more time. And now. Good, yes. Okay, let's do one more. And how was that? Yes, it's actually my own homemade maple syrup from Canada. Isn't it delicious? Oh, I love it too. You can take some home if you'd like. I have some complimentary samples in the side there, right by that table. Do you see them? Take them home. It's for you. Okay, and I'm realizing that I actually forgot to check your heart, and so I am going to do that now. I want you to just breathe normal for me, okay? Okay, now I want you to breathe in really deep. Okay, good. Breathe in deep again. And out. Good, 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 good. Alright. Your heart rate is perfect. I do want to check your lungs now, so I'm gonna have you breathe deep again. if you have anything that you need, you can call me, okay? Anything at all. Alrighty, well, thank you for coming in to see me again. I hope that you're doing well, and I hope you have a wonderful rest of your day.